Hello, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the humeroradial joint. So the proximal component or the proximal articular surface of the humeroradial joint is humerus, and the part of humerus is radial fossa and the bell-shaped capitulum. Distal articular surface is cup-shaped superior aspect of the radial head or the fovea, and it is a ball and socket joint, and the movement in this joint is elbow flexion, extension, forearm pronation and supination. Elbow flexion and extension with anterior posterior glide of the radial head on the capitulum of the humerus. Forearm supination or pronation with the radial head spinning medially and laterally on the capitulum of the humerus. Next joint is proximal radioulnar joint. So proximal component consists of a concave radial notch of the ulna, and distal articular component is consist of a convex rim of the radial head, and the joint type is a pivot joint, and its motion is forearm pronation and supination. Forearm pronation with posterior glide of the radial head, and the forearm supination with anterior glide of the radial head. And the degree of freedom is occur in the one axis, that is only supination and pronation. And the resting position of this joint is 70 degree of elbow flexion and 35 degree of forearm supination. Next are the muscle action at the elbow. So elbow flexors are the three muscles, that is brachialis, biceps and the brachioradialis, in which biceps brachii are the agonist or the prime mover of the elbow flexors. And biceps brachii consist of two head, that is long head and short head. Long head has two joint muscle, most affected when shoulder extended and forearm supinated, and short head is a single joint muscles. Next is brachioradialis. Brachioradialis is activated when joint stability is needed, that is it acts as a synergist during elbow flexion. Next are the elbow extensors. So there are two elbow extensors, that is triceps brachii and anconeus. Triceps brachii consist of three head, that is long head, medial and lateral head, and this muscle is inserted in the olecranon process of the olecranon process of the ulna. And the factors affecting the strength of the triceps brachii are elbow position and shoulder position. And the anconeus is act as a synergist during elbow extensor. So it stabilizes elbow during forearm supination and pronation, and it is against the valgus stress. Thank you.